Now today in this video, I'm gonna answering some of the most common questions that's being asked by my lower back clients and some of the myths that we're gonna bust today. So let's go! Hi, I'm Melanie the Physio, also the co-founder of Capital Physiotherapy here in Australia. In this channel, we have a whole playlist dedicated for lower back pain. Even though the title might not suit you, I still highly recommend you check them out because I guarantee you there will be some information and exercise that's going to help you with your lower back pain right now. Now, the first myth that I get, or the first question that I get from a lot of my clients with lower back pain is, do I need a scan? Or the scan would actually show me what's wrong with my back. There are many research that have already proven that the scan from our lower back, whether it's MRI scan, CT scan, it's actually quite poorly correlated to the symptoms that people normally feel. A lot of the time, many people who is symptom-free can do a scan on their back and shows these bulges, degeneration, all these changes that's happening in their spine, but then when you look at them in person, they're actually completely asymptomatic. And on the other side, we have people whose scan shows fairly fine and the pain that they're experiencing is like completely different. Like they couldn't get out of bed, they couldn't stand, they couldn't sit for too long. So a lot of the time the scan doesn't actually tell a physiotherapist or any physician like what's really going on in the actual back that's causing the pain. Most adults without back pain will have changes in the anatomy of their spine that are visible age-related adaptation that don't cause any problems. The truth is, spine abnormalities are as common in people without back pain as those that have back pain. Now, if your muscle is spasming or you strain the ligament, it wouldn't show it in the scan. Even if you have a disc bulge and the scan shows this bulge, it doesn't correlate to the actual severity of how painful you feel a lot of the time. Therefore, physical examination, by just testing your movement and asking you certain questions, has actually a higher correlation with pain and have an easier way for us to find out what is actually causing your pain than an actual scan does. Normally, most of the time when we actually send people to scan is that we feel that there's something a bit more sinister going on, or if we feel that the back pain is severe enough that we need to refer you to an orthopedic surgeon or a spinal specialist, that's when we will order people to get scan done. Other than that, generally scans are not very helpful in the rehab process if we can just improve you through rehabs. Now, physiotherapists are trained to treat lower back pain quite effectively just through physical examination. In fact, research has shown that people who have done scan earlier in their rehab phases have actually higher risk of getting chronic lower back pain than people who've never done scan in the early phases and actually have a better chance of full recovery. Now, the problem doesn't lie with the scan itself, but what people were told about their results and what happened next. Unfortunately, people with lower back pain are often told that these non-serious things such as disc bulge and arthritis needed more testing, more injection, more specialist appointment, as well as a lot of unnecessary and expensive procedure. Now, what happened to these is not the actual procedure that affects their rehab, but it actually caused a lot of worry and anxiety for people who is experiencing lower back pain to not trust their back to do movement and to do exercise because they feel that it's more serious than it actually is and they don't trust their back and it hinders the way we can rehab them. That's why most of the time people will come in with extreme lower back pain, no matter how bad it is, whether they can't get out of their bed, they feel referral pain down their leg. We generally don't refer them to a scan for about 6 to 8 weeks of intensive rehab before we decide whether a scan is necessary or not. Let me know down in the comment section below if there's any myth about lower back pain that you know of that you would like to share with the rest of us as well. Now, the second myth that I hear about lower back pain is that resting or avoiding movement that cause pain is the best thing you can do for your lower back problem. However, there has been a lot of research done about lower back pain and have been proven over and over again that being active and doing usual activity and returning to work and hobbies and activities is the way to go to help aid your recovery for your lower back pain. Avoiding it actually have a worse outcome. So things like bed rest, avoidance of movement that cause a higher level of pain would lead to greater disability, poorer recovery, and greater absence of work. A lot of the time, the pain that you're feeling is mostly due to inflammation or muscle spasming rather than an actual structural damage to your spine. So therefore, if you move around gently and as best as you can and frequently, you are actually helping to resolve this excess inflammation faster and therefore reduce your muscle spasming as well. Therefore, as a job of physiotherapists in the early phase is for us to educate people that pain does not equal to damage and what is acceptable and what is not acceptable, and slowly guide people back to normal movement again. That is why you need to see a physical therapist when you experience lower back pain, to guide you through the right movement at the right time and at the right pace to ensure a high chance of full recovery. Exercise is actually good for lower back pain, and in fact, exercise is the only approach for lower back pain that have been proven multiple times through research that it actually prevents recurrence of lower back pain to almost 50% compared to other intervention. It is very, very important for people to understand, especially people who have lower back pain for a long time, to understand that pain doesn't equate to damaging your back. And the more you stop moving and the more you avoid certain movement, the more deconditioned your back becomes and the worse the problem will get. Now, the third myth is that having bad posture or bad lifting technique is the cause of your lower back pain. Now, it's not fully incorrect that people say hunchback caused lower back pain, because hunching your back actually causes more load on your spine, but the actual bad posture is not the cause of your lower back pain. Now, it's the constant inactivity and lack of movement that is causing the discomfort in your back. Now, if you slouch for a long time and not move for a long time, you are loading the spine at the same stress at the same location. That's what's causing your lower back pain. And on the contrary, if you're sitting up tall and you're constantly staying up tall and not moving as well, that will also be uncomfortable and cause discomfort as well. Therefore, you'll find people who sits for a long day have lower back pain, people who stands for a long day have lower back pain as well, because neither sit nor stand is actually great for you for a prolonged period of time. So it's not the actual position that you're in that's causing the lower back pain, it's the lack of change in position that is actually the root cause. So if you have terrible posture, but you don't stay in that posture for too long, you would actually have no back pain. Or if you sit for a long time in great posture, but if you only sit there with great posture, you would actually have a higher chance of having lower back pain than people who have terrible posture but is actually constantly moving. Now, our spine is a very mobile joint. It is designed to bend, to arch, to twist, to tilt in all directions. That's what the natural movement of the spine is. And depriving it from that, like if you're not doing those movements and you're just keeping your spine still, that is what causes people to have lower back problem or back stiffness or back issue in general. The key to not having lower back pain is constant change of position. That's why we normally encourage people who sit in the desk for too long to have a sit-stand desk. So you sit for a while, you stand for a while, you walk away for a while, you come back for a while. It's the constant changing and the regular stretches and movement of the spine in between those prolonged period is what's going to help prevent you from having chronic lower back pain. The fourth myth that I hear a lot is that my body is asymmetrical, so I walk funny, my leg length is asymmetrical, that's why I have lower back pain. Now, I'm here to debunk this myth because asymmetric is normal. It is absolutely abnormal to have a completely symmetrical one side to the other. Our body is designed to adapt to all these little changes, and our body is designed to use one side more dominance than the other. Therefore, it's only normal that it shows in our spine, it shows in our body some sort of asymmetricity as well. So do not get freaked out that you have a little bit of a leg length discrepancy. Do not get freaked out that your hip is twisted one way more than the other. Do not get freaked out that your spine is slightly different in terms of muscle bulk one side to the other. All these are normal. Now, this asymmetrical problem is important to bring up, I think, is because there's so many times that I hear clients coming in telling me that they need their back to be twisted, their leg length is different, that's why they need a regular tune-up to like realign their spine so that they feel better for a while, and then they have to keep coming back to do the same thing. Now, that is a myth, and that is absolutely untrue. Now, the whole idea of cracking your back to realign them is untrue to begin with. Now, those cracking that you hear is what we call cavitation. It's just basically an empty space or gas bubble that is like caught up in your spine. It's almost the same as cracking your knuckle, like this. Nothing different. Now, I'm not saying cracking is bad, but it certainly doesn't do much benefit either. You will feel a natural sensation relieved and looseness just for a short span of time. But all those are very temporary, just like cracking your knuckle. Like after I cracked it, I can't crack it again instantly because there's no more empty spaces in my joint anymore. Now, the whole idea of manipulation is not about cracking. Manipulation is introducing movement to your spine that hasn't had that range for a while. And as a physiotherapist, we rarely do it, even though we are taught to do it, because there's no long-term benefits to like cracking your back. What we encourage people to do is introduce those movements to your back by yourself so it becomes habitual, so you maintain those range and you keep using those range throughout your daily activity. That is a more sustainable way, and that is a better way to actually keep yourself having a flexible joint. So we use manipulation to increase your range a little bit more than what you normally do on your daily basis, and then on top of that, we then give you exercise to then keep it that way and maintain it that way. We just introduce those movements to your back that haven't been used for a long time, that haven't used those range for a period of time, and then teach you on how to maintaining those range. Whether it cracks or not, that is totally not the point. Now, if you'd like to learn more about your lower back pain, head on to our private Facebook page at Ask Mel the Physio, and in there you would have access to all the free PDF that we have on all body parts up till this far. And not only that, you will also have all the other free educational booklet that we will have from now onwards. If you just started having lower back pain not long ago, like 1 or 2 weeks ago, and you're trying to cope with it, make sure you watch this video up here. Now, if you have lower back pain for a long time now, I highly encourage you to then watch this video down there. I'm sure these two videos will help you with your lower back pain. I'm Melanie. I upload video here on a weekly basis on health and fitness related topic as well as injury rehab topic. I will see you in the next video. Until then, stay safe, happy, and healthy. See ya!